A pandemic is a global outbreak of a disease. It has been a while since we've had a pandemic, but we have experienced them. For example, the most deadly pandemic in history was in 1918. It was called the Spanish flu. This virus infected a third of the world's population and was responsible for causing between 20 to 50 million deaths. Another example was the Asian flu pandemic in 1957. This virus was responsible for 1.1 million deaths worldwide. The main two concerns I have seen with my patients are they're asking for ways to optimize their immune system just in case they come in contact with the virus. They're also concerned that they may be asymptomatic and infect their loved ones, such as elderly patients. I have a patient whose spouse who recently had a kidney transplant. And then they're also concerned about exposing the virus to their children and not knowing it. I am asking that my patients stay home and that they only venture out for essential needs. And when they do go out, to wear the proper PPE, which would include a mask as well as gloves, and to wash their hands frequently for 20 seconds or longer. When I get a call and a patient feels like they have been infected by COVID-19, we do a checklist of their symptoms. So I'm asking, do you have a fever, dry cough, muscle pain, trouble breathing, diarrhea, a decrease in taste and smell? If they have most of these symptoms, I suggest that they quarantine themselves in a room away from family members for at least 14 days. I have them monitor their fever and to not take anything for the fever, like ibuprofen, unless the fever is above 104 degrees. I explain to my patients that fever is the body's response to the virus, and that this is one of the ways the body helps to kill the virus. Research shows that fevers below 105 degrees is not a strong indication for antipyretics unless they are experiencing organ dysfunction. I want them to just kind of ride it out. I want them to stay hydrated. I want them to listen to their bodies. Many times there is no desire to eat, and that's okay because fasting has many beneficial properties as well.